Hello, I'm Dr. Abhishek Day. I'm Senior Consultant in Wisdom Skin Clinic. I've been practicing here in Wisdom since 2011, and I'm also Associate Professor in Calcutta National Medical College and Associate Editor of Indian Journal of Dermatology. Today I'm going to talk about anti-aging treatment. See, aging of the skin starts in the very beginning of our life. A lot of people think that at 30s or 40s or any particular date or frame, the aging starts. It's not. We start aging as soon as we are born. However, the different aspects of aging start showing after certain years, like 20s or 30s, it starts showing. Depends on a lot of factors. There are genetic factors and also the epigenetic factors. The lifestyle factors are also important. There are two kinds of aging happens. One is the chronological aging. That's what happens when you grow normally, and there are a lot of factors also kind of increase the chronological age, like your genetics may be sometimes responsible, racial factors comes in, kind of skin type you have. Then also there are factors like whether you have been under a lot of stress or the smokers. All those factors lead to kind of hastens chronological age. But another important factor is basically photo aging. Many of you may have seen that people who work in the fields or people who have an outdoor job tend to age faster than the people who are having a job which is kind of, desk job, stays inside home. So photo aging also is an important aspect of aging. So together we see signs of aging, and that's what people also appreciate. We doctor also see in a patient who start showing some signs of aging. So every patient of mine asks, how to stop aging? Can I reverse the aging? Now this has multiple factors. I say that some part of its genetics, of course, but some parts are on the treatment I will be giving to the patient, and some part also on the patient's hand, the quality of lifestyle. Now the anti-aging typically begins at the patient's end. Now, all my patients, I advise, good quality lifestyle. When you sleep, when you get up, kind of food you are taking in, whether you are obese, whether you are doing daily exercise, yoga, all those things, and what kind of stress you are there. If the patient is a smoker, I always try to, kind of counsel them to quit smoking. All these factors are important. And then also comes certain basic skincare. I would love to, kind of compare skincare with basically gym. Now, if you go to a gym and a very fast day do 4 or 5 hours of exercise, it doesn't give you anything except for you can become too tired, muscle can be fatigued, you can pick up some injuries. You need to build up a exercise habit. So maybe 40 minutes of exercise for 4 years will give you very good results. Skincare is also about that. Too many products can actually not be good for your skin. We need to build up a skincare. So I am pretty basic about the skincare. I usually give my patients some kind of sunscreen which will be suitable to patient's skin, nice scented cleanser for the cleansing the faces, nice moisturizer elements, and sometimes certain products which is kind of helpful for the patient type. Sometimes like I use retinol for an anti-aging purposes. I also give patients Botox like topical Botox, that's Botox like peptide, which is pretty in thing these days. And also I advise my patient to check their vitamin D3. If there's low, then take vitamin D3 supplementation. I give collagen for the patient, and pretty recently we are using NAT+ therapy also for the patients, anti-aging. So these are the things patient can do at their home and doesn't require any procedure. You can begin even in your home, and this is also a very important part of anti-aging treatment. But even if you are doing very good skincare regime, you have a very good lifestyle and routine, still there will be some imminent signs of aging. And broadly in the face, we can divide the face into upper face, middle face and lower face. And I'm talking about most important factors in Indian patients. So what you see in the upper face, near your eyes and your forehead and the glabellar area, you see a lot of lines. This is upper face lines with the expression lines, and sometimes they become fixed and we call it resting lines. So upper face, I see a lot of wrinkles. usually around the eyes and the upper glabellar area, the frown lines and the foreheads. And for that, the age-tested treatment is botulinum toxin. Now we have different brands of botulinum toxin in use in India now. You can choose with a collaboration with a dermatologist, and be sure that you are either getting it done under a dermatologist or a plastic surgeon, because it's very important to know the muscle anatomy of yours and customize the Botox treatment for you. Roughly about 50 to 60 units requires for upper face treatment in most of our patients. Lot of patients have a lot of fear factor against Botox. Botox can make you look plastics. Botox is a toxin. Actually not. Botulinum toxin don't sound like a toxin, but it's actually a peptides, and it's a very good to relax your muscles. Can give you very smoothens your expression lines, and that's what gives you kind of calm and cool look, and that's everybody wants. The only problem, many people believe that the Botox effect goes off. That is true. So roughly 4 to 6 months Botox effect tend to wane off. So you need to do redo with your doctors every 4 to 6 months, depends on how fast you are waning off the effect. But if you keep on doing botulinum toxin, there is no side effect. And let me tell you something. Botox has been used regularly in aesthetic practice in 1970s. And for 50 years in all over the world, it has been a pretty popular practice, and there's a no red flag and Botox. So it's a pretty safe procedure to be done when done under the right hands. Then in the mid phase, we see a lot of volume depletion. We see tear trap, that is the periorbital hollowness. All those things are come. And in the lower phase, we tend to see a lot of sagging. This is the very basics way Indian patients age, and that I've been saying for last 15 years of practice. And we need to address all of them. If you just do one part of the treatment, you may not have a good holistic improvement of your skin and face. Now, how to address that? It cannot be addressed with a single procedure, but couple of things can help. Like first of all, you can do a little bit of tightening, and for the tightening, I usually like Forma a lot, which is basically radiofrequency based tightening. Also, I sometimes use Endimate mini shapers. All those things tend to hit up your collagen and give a nice tightening effect. But even with that, there are a lot of volume loss which had to be replaced. Otherwise, the face doesn't look natural. And to replace that volume loss, what you usually known as fillers, there are plenty of fillers. Many fillers we use in depending on which position of the skin we will be putting. Overall, the fillers are extremely safe procedures when done in right hands, either by the dermatologist or by a plastic surgeon. And these are very simple half-an-hour procedures. You can go home without any kind of side effects, and doesn't require too much of downtime. So most of the fillers last for 1.5 years to 2 years up to. So kind of gives you a certain amount of semi-long time relief from your sagging lines. All the nasolabial folds and the marionette lines, all those areas can be treated by fillers. Be always sure that what kind of product you have been using. We have excellent products available in India now, and if you do it in right hand, it's actually pretty painless procedures, and you can give a very lasting, rejuvenating lift of your face just within a half an hour in a lunchtime procedures. In the lower face, I always see in Indian patients a lot of sagging happens, a lot of extra fat. Many of our, kind of 40s or 35s and 50s, we see a lot of sagging and extra fat. These areas, jawline is not exactly sharp, and these are the areas where we use HIFU to tighten that. HIFU, the name is high intensity focal ultrasound. It's an ultrasound based technology, almost painless. It takes about half an hour to 1 hour procedures. You can do, it's a daycare procedure. There's no downtime. With the HIFU, we tighten our lower face areas. The fat and the collagen tissues are heated up, and the effect is kind of semi long lasting. And if you are like maintain yourself and do not into a lot of smoking, drinking, and a lot of sugar intake, then the HIFU procedures you tentatively last for about 1.5 years to 2 years. So that can be good thing for you, that you can tighten up your skin and it kind of last for a little bit more. And people who are like afraid of injection, these people tend to love HIFU a lot, because it's just an ultrasound guided massage like treatment. It doesn't really pinch you or like prick you, so it's a very effective treatment. And if you're done in the good hands and the right clinics, then this always gives you nice tightened jawline. And sometimes it can be, we use sometimes little bit of jawline filler along with the HIFU, so that even the sharper jawline can be made. Many of Indians, I find the chin and the temple areas, there is a little bit of volume deficiency, not by the aging but from the birth also. In those patients, even younger age, I use a little bit of fillers to either in the chin areas or also in the jawline here. If we combine all these procedures, like I've been talking botulinum toxin and the fillers and the HIFU and forma, so many patients require different kind of treatment, and that's why a good dermatological consultation is very important. Your dermatology, with his all the wisdom and the knowledge, will kind of dish out the right prescription for you, what is exactly good for you. So if once you find a right nice protocol for you, then the overall holistic improvement of skin is just few hours waiting. Another thing what people notice in the 30s and 40s, and especially post-menopausal women, that facial skin become increasingly dull. And for our technical term, we say it's lack of hydration of the skin. So there's fantastic skin booster like hydration treatment available there. It's like 15-minute procedures in a office hours, and you can just come for lunchtime procedures and get it done. Now once you do the procedures, these are hyaluronic acid, small molecules. It's not fillers, it's just put in the epidermis of the dermis of the skin. And this, if you have a good intake of water, this hyaluronic acid holds water, and therefore your skin feels very hydrated. And once the skin is well hydrated, then you reflect light little bit more than you do normally, and that gives you a nice little glow. This glow is not like makeup, it's kind of permanent glow. It lasts at least for 6 months to 9 months, and that's why this is a pretty simple procedure to add to your normal Botox, fillers and other procedure you are doing. Ask your dermatologist for skin boosters or skin weave or Profilo, which can add the extra bit of shine in your skin. So a lot of my patient asks, okay, doc, I'm just 20s. I see signs of aging in my skin, but should I go to a doctor? Should I treat it? Isn't anti-aging is for the 40s? I'm just a young kid, I'm just in my 20s or 30s. Actually, it's wrong. You tend to see little signs of aging pretty early. And many of these treatment I mentioned, like suppose botulinum toxin or suppose hydration treatment, these are pretty simple procedures. And if you do it early, then you actually can slow down the process of aging. And sometimes the doctor may not give you injectable treatment or HIFU or anything else procedural treatment, but can give a nice certain regime for your skin, which will be suiting your skin. So talking to a doctor early, whenever you see little bit of signs of discomfort with your skin, you're not happy with your skin like earlier you used to be. Skin feels little dry, dehydrated, lack of glow, skin has a lot of acne and leading to a lot of scars, or skin shows little bit of signs of drooping down or sagging, or if you see little bit of fine lines coming in your forehead, do not waste time. If you go to your derm early enough, then derm can give you a regime or routine that you can delay down the signs of aging or the aging process, and that may actually reduce your amount of procedure needed to be done. And all the procedures done early in your life actually gives way better result than allowing the lines to kind of creep in and then try to do the procedures. One good example is, all our foreheads and side of the eyes, we see lines while we are giving expression. When you give expression and the lines comes, we call it dynamic lines. If you tip the dynamic lines in Botox, then it gives beautiful, soft expression lines. But if you wait a lot of time, like a decades, and allow this dynamic line to become resting line, that even if you are not giving expression, still the lines are coming, then even if you do Botox, the line doesn't go up. So actually botulinum toxin is basically an anti-aging, and you start before the aging has completely set in. So I would always advise my patients, whenever you are not so happy with your skin, come to your dermatologist irrespective of what is your age.